Hello, everybody. Joshua, say hi. Come here.
Hi.
There you go. Oh my god. And his mouth is all dirty and covered in chocolate and yogurt, but that's the life of a soon to be 4-year-old. So, see, there I go already, starting off the video with so. My nursing 2 class started this week, and I had clinicals today. The first day of clinicals for the semester, and I've forgotten what it's like to do clinicals and do AM care and be on the floor. And I felt like really lost. I felt so stupid today. Like I was having trouble like even making a bed. It was really sad. And in my clinical group, we have we have for my last semester's clinical group, it's me and 2 other girls, and then we have another girl that was in another clinical group, but she's a sophomore, and then we have 3 new people, and by new they're repeaters, so they had an issue with the class, so they failed, and then they resubmitted their application and all that stuff to be re-enrolled. So for them, this is their 3rd clinical semester, so they know their stuff. So today I had one of the repeaters in my class. Yeah, okay, in my room with me with my patient, and I just felt very intimidated. I think that's what totally threw me off today. But she helped me, helped change my patient's diaper and she was really, really, really good. And I thank her over and over because I don't know what happened. I don't know what happened. I'm just gonna assume that because it was the first clinical day and I hadn't been in the hospital for over a month, that's what's throwing me off. So we'll just leave it at that. But I can see already from looking at the syllabus and all the materials that we were given that it's going to be a pretty crazy semester. I've already been feeling overwhelmed, but I guess that just comes with, being a nursing student. So, with that being said, this video will be on how to study for exams, and whether it be lecture exams, final exams, I think these tips help out regardless. We on certain days we have lecture, we'll have workshops, and those are usually done by our instructors or some staff that works at the school. And one workshop that I found to help a lot last semester was a test taking workshop, and it was taught by one of the instructors, and she is very good with psychology related topics. So our entrance exam was like a cognitive exam, and she's just very good at pinpointing things from a psychological perspective, which is kind of cool because I guess that my bachelor's degree in science, yeah, my bachelor's degree in psychology isn't, totally gone out the window. So, she understands, well, I understand where she's coming from and how she's teaching and how she does the workshops. So, last semester, we did a test-taking workshop, and I'm gonna see now. I can't remember if the tips that I'm about to say, if they're all the instructor's tips or they're my tips as well, a mix of the two. But let's get started, shall we? Okay. So, a big thing with nursing. Oh, sorry, I'm like changing the scenery. I'm so uncomfortable right now. But a big thing. Yeah, let's leave it there. Okay. laptop's all crazy. But something that I don't want to say I'm infamous for, but when I was doing my undergraduate study, I used to cram a lot. Didn't work out because then you have a complete mental breakdown. Your brain is fried and you don't remember anything. So don't cram, especially for a nursing program. When you know that this is going to be your career, cramming isn't gonna do you any good because one, you're not going to retain anything, and two, how are you going to apply that stuff later when you're on the job and you're like, oh, I remember they taught that in first semester. Yeah, well, if you didn't cram or you studied with time, you'd probably remember. Or if you've never seen it or dealt with it, then you probably won't remember. But anyway, don't cram. It's stupid, and it don't work. The week that the material is taught, so in lecture, that week is when take that whole week and as much as you can study that one lecture. So like for example, our first lecture was on diabetes. So for this entire week, I'm kind of just focusing on that. So that way, the week of the exam, well, not the week of the exam, but the week before the exam, I will have studied all the other lectures and kind of know them pretty well, so I can spend time on the last lecture and try to review everything overall right before the exam. So that helps. Okay, so tip number 1 was don't cram, and tip number 2 is take breaks every 45 minutes to an hour. I would even push it as far as to say every 30 minutes to an hour, because it really honestly depends on you, like your attention rate. I know depending if I'm having an off day or I'm tired or if there's just something not right, I will have to take breaks every half hour because I cannot focus and continue to study. And then I'll have my days where I'm fine, and then I'll, take a break every hour or 45 minutes. So that helps. Really do take breaks. And an interesting thing that our instructor told us during the workshop was that most adults can only focus for this amount of time. So, that's the amount of time that they can focus on something and retain some. Oh God, the cats are acting psycho. Well, what else is new? Cats are crazy, right?
Stop.
Right. Okay, so that was tip
Mama, can you say stop?
number 2. Right? Wait a minute. I lost my page. Okay. Yeah, that was tip number 2. Okay. And now, tip number 3. And the next couple of tips, I guess they're kind of clustered together. Okay, so I have 3 tips here, but they can really go under one category. But let's just do 3 and then like 3A, 3B, 3C. So, tip. Itchy nose. Okay. Tip 3. I'm sorry. I keep moving my laptop because my son keeps moving on and off the bed. So he's like kind of crowding me over here. Okay. So tip 3A is assess. And that means, go over everything, whatever lectures will be covered for your exam, kind of go over that material. And
Mama,
yes,
it's a wheel.
so you're gonna assess what you don't know,
P.
and you are gonna, like, I guess if you want, write it out, type it out, whatever is good for you, but just really be aware of what it is that you don't know too well. And once you can look it up in the book, look it up online, anything, once you kind of sort that stuff out, then tip 3B will be create a study plan. And this means, well, what worked for me, and this was the tip our instructor gave us, was focus on the hardest material first and set priorities. So if there's something you know that you're having a really hard time with, which for nursing one for me was fluid and electrolytes, but it was mostly because there's a lot of hypo and hyper values and signs and symptoms and treatments and all that stuff that you need to know. So that was the toughest for me. So I focused on that the most, and that's what I focused on first. Sure, give me 1 second, Joshua. And so that way, by the time I reached the easy material or the stuff that I knew, studying wasn't too bad. Okay, and tip number 3C is mix up reading, going over notes, and doing the NCLEX questions or end of chapter questions. So basically, you don't want to just read because that gets old and you don't. Not that you're not learning, but you need that variety to retain the stuff, or else you're just committing it to memory. You want to be able to apply what you're learning, And an interesting tip, well, a very helpful tip that our instructor gave us was when purchasing the NCLEX book. I know, books online are cheap, which they are. You can find them pretty cheap on Amazon usually. And what she suggested was go to a bookstore. You go to the nursing section, you look through a couple of NCLEX review books, and you can then copy the ISBN number and you can find it online. But the whole thing of going in person and seeing it is that way you have a sample of what the material is about. A lot of everybody learns a different way. So if you're a visual learner, try and get a book that has pictures or diagrams or anything like that. If you're one to just read, then obviously get one that's just words, but that's a little lame. But whatever NCLEX review book, I'm sorry, I'm like so tired from clinical and stuff. I've been up since 5, but anyway, whatever NCLEX book suits your study style and your learning style, you should purchase it, because it's just going to make, studying for the NCLEX that much easier, right? And last tip is always remember when you're answering, well, this is also a tip that you bring with you into exam, aside from when you're studying, but when you're answering a question, it's not really answering the how part that's important, but rather why it's important, or why something is the way it is. Because you can try and memorize it all you want, but if you can't apply what you've been taught, you don't understand it, for one, and 2, you didn't learn it properly. 3, you're not going to be able to apply it into real life scenarios and situations. So when you see that you can take a term, a disease, a lab value, anything like that, once you can see that you can take it, know what it means, and then like you're in clinical and your patient has that, whatever it is that you can apply it to, then it's just so much easier to understand. Because then it's like an aha moment. You get that light bulb moment, as our instructors like to say. And it's just going to be easier for you and better for you to retain if you can apply it. So, quick summary of my tips. So, tip 1, don't cram. No bueno. No good. Okay? Tip 2, take breaks every 30 to 60 minutes. Tip 3A, assess what you don't know. 3B, create a study plan. 3C, mix up reading and answering questions. And tip 4, always remember, it's not how, but why. And that is it for this video. So my next video will then be on test taking tips. And I'm not too sure when I'll do it. I don't want to wait too long between this video and the next one, but I'll just probably be really busy with school stuff and whatnot. But until then, see you later. Bye.